More than 90% of Australians are fully vaccinated, and the message to them is to get boosted.
Today, Brendan and I have had our Moderna boosters.
1 in 8 people over 16 have received their third jab, which is just under 10% of the population overall. But as the Omicron strain takes hold, the government has been keen to accelerate the booster program. Today, thousands turned out at vaccination centres as the interval between second and third doses was shortened from 5 months to 4. But some vulnerable people say they're struggling to get the booster.
I am obese. I am also, I've got autism, and I've also got the respiratory condition. I was classified as 1B, so I had priority access to the vaccine in the first place.
Jess Larkman lives on Russell Island in Queensland. She receives the disability pension and was due to get a booster shot next week, but says her appointment has now been cancelled because the GP doesn't have enough supply.
But, they've postponed it, and you've got to ask the question, will they postpone it again?
It's a 20-minute ferry ride to the mainland from Russell Island. With case numbers rising, Jess says she's too scared to travel and is now living in isolation.
Here on the island, I think it's 1/3 elderly, 1/3 disabled. So this is an obvious place to put, some sort of vaccination centre, let alone make sure that the local distribution places, which is the chemists and the doctors, have plenty of supply.
The official in charge of the rollout says the booster program is going to plan.
Supply absolutely isn't a problem. We've got more vaccines than people who are eligible in the country right now. Yeah, there's some anecdotal stories of some issues, but we're working to resolve those as we can.
Bringing booster shots forward by a month means 4 million people are now eligible. At the end of the month, the booster gap will drop to just 3 months, making another 8 million people eligible. Next week, children aged between 5 and 11 will also be eligible for vaccination.
On top of this, we have record numbers of COVID positive people, and most of those are going to be managed in the community. So it really is a perfect storm.
Health professionals are warning the system could become jammed.
Part of an issue might be getting it out to general practice clinics and getting it into the fridges in time. But it's also about just the sheer number of people who need their boosters right now.
The Royal College of General Practitioners says while there may be enough vaccine doses, there aren't enough staff to administer them.
It's not a supply issue in as much as the products of vaccination. It's more a staffing issue to manage that volume of work. Healthcare in general must always look at the most vulnerable parts of our community first.
I think the assumption is that most people in vulnerable groups were prioritised the first time around, and so would already be hitting their 4 or 5 month mark at this point, because a lot of people, including and especially pregnant people who became pregnant in the intervening time, wouldn't have been prioritised the first time around.
Screen editor and first-time mum Grace Ear is 24 weeks pregnant and concerned that she and her unborn child could be vulnerable as cases in Melbourne soar.
I won't be eligible for my booster until early February, at which point I'll be 4 months from my second dose. But ironically, that's also the time that the time frame, the waiting period, drops to 3 months. So I would technically be eligible for it now or within a day or two if the 3 month timeline was already in place. If I were to contract COVID in the next month before I'm eligible for my booster, I'm at higher risk of complications, of admission to the hospital, of the intensive care unit, and my unborn child is at higher risk of being born prematurely, which could have a lifelong consequence for him. And that's all down to just a month-long wait period where I'm exposed and at higher risk in the community.
For the next month, Grace will be avoiding any extra risks.
I basically try to confine myself to my house as much as possible. And at the same time, I wear a mask as soon as I leave my house, everywhere outdoors. And I basically don't take it off until I get home again. It's basically the only thing that I have control over at the moment.
The federal government says it is prioritising the nation's most vulnerable. Throughout the pandemic, almost 1,000 deaths from COVID-19 have occurred in aged care, and yet, as of today, only half of the nation's homes have had boosters made available.
We definitely need a focus on rolling out the booster program as quickly as possible from here.
That means 1,300 aged care homes are still waiting for their booster shots. The government disputes this and says all aged care homes will have access to booster shots by the end of the month.
We need to protect older people who are vulnerable, both in residential care and people who are receiving care at home. My guess will be that there will be some further pressure on availability through January and February. We need to make sure that aged care is prioritised through that period.
With case numbers soaring, many families are again facing anxious times.
It's just really stressful, and to take it to the next degree of saying that, you're at increased risk of getting COVID, you're increased risk of dying as well. It just, I end up, avoiding going out. I haven't seen my friends. It's terrible at the moment.
It kind of feels like I've been forgotten about.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.